We Are the Medicine podcast is a healing space for the soul, where the focus is finding and activating the inner healer that lives within each of us. This podcast explores what it truly means to heal ourselves from the inside out. You'll learn practical mind-body tools to regulate your nervous system, release emotional pain, heal your inner child, and reconnect with your empowered, authentic self. Each episode invites you to journey beyond symptom management and into the emotional, energetic, and spiritual roots of health and vitality. If you're ready to remember your wholeness, to embody your truth, and to reclaim your emotional freedom, this is your space. You'll discover that the medicine you've been seeking is actually within you. I am your host, Dr. Liz Burkholder. My mission is to spark this inner healer within anyone who feels called to do this work. Join me on a journey to reconnect with our bodies, our hearts, and the healers within ourselves. You are the medicine. I am the medicine. We are the medicine. Before we dive in, I would like to offer a brief content note and trigger warning. This episode includes discussion of sensitive experiences such as abuse and sexual trauma. Please take care of yourself as you listen in a way that supports your own nervous system and body. As always, you are invited to pause and honor whatever your body needs in the moment. Hello, and welcome back to We Are the Medicine podcast. I'm Dr. Liz Burkholder, and this is my second episode, and it's all about what I call my second awakening. And I will preface that we have many awakenings throughout our lifetime. Awakening is just becoming aware of ourselves and awake to who we are and what we are and why we're here. At least that's my quick definition of an awakening. So my second awakening began in 2016. So I had gone to nursing school, and then I loved it so much I kept going, and I ended up getting a bachelor's degree in nursing and then a master's degree as a family nurse practitioner. Ended up moving to Washington, D.C. with my husband at the time and enrolled in George Washington University. Shout out to George Washington University to their nurse practitioner program, which was amazing. Also, back up, I'd like to shout out to University of North Alabama, which is where I got my bachelor's degree, which was an accelerated virtual online program at the time. So when I moved to Charlotte, I became an oncology nurse working in oncology, which is cancer, and actually became a certified oncology nurse giving chemotherapy and taking care of cancer patients, which was a very expansive experience in itself. So it was a very humbling and beautiful experience being an oncology nurse, and it stretched and expanded me in lots of ways. Took care of patients who were very sick, very ill with cancer and on chemotherapy, and some at the end of their lives, and helped some patients transition out of this life, and very humbling experience. And I loved it for a long time. I loved it. It was exhausting work as a nurse. Those who are nurses know this. We worked 12-hour shifts. I worked night shift for a long time, and then I kind of went back and forth nights and days, and it can be very exhausting. We're on the go all the time, constantly moving, walking, taking care of people, constantly putting out quote unquote fires. It's a very taxing job at times, but again, very humbling, very rewarding. I love nursing. Sometimes I say it was kind of like a saving grace for me, and it gave me a route and a direction into my purpose. My career path has taken many twists and turns at this point, and not the traditional or conventional nursing route by any means, but I apparently don't do anything by the conventional or traditional route. So I was a cancer nurse for several years, and we ended up moving. Well, we were living in Washington, D.C., and I was enrolled in the nurse practitioner program, working as a nurse. And then I got pregnant, and I had my first baby in D.C., and then was still in the nurse practitioner, the grad school program, and then got pregnant again and ended up having my son while I was in grad school as well. So I got pregnant and birthed 2 babies during the span of time that I was in this nurse practitioner program, because this is how I do things. I do many things at once, which eventually led to some burnout for me, which we'll talk about in the third podcast. Anyway, so then we moved back to Charlotte. I began working as a family nurse practitioner, and I quickly realized that I wanted to do mental health. I mean, I liked family medicine, but I knew in my heart that mental and emotional health is my primary love, my first love. I originally thought I was going to be like a psychologist or some kind of therapist or something. And I took a really long route to get there. But, I mean, to get to doing therapy with people, but at a very, again, unconventional, non-conventional route, which is how I do things, apparently. So I began working at this mental and emotional health center, and I realized this is horrible. This is horrible, seeing 20 or 30 patients a day with severe mental and emotional health issues and having to diagnose and prescribe and come up with a plan all in the span of like 15, 20, maybe 30 minutes. And I started having anxiety doing this job. Like, I was like, wow, I feel like I need to be on medication to do this job. So I was like, this job is giving me anxiety. So I realized, wow, the way that this is happening is not sustainable. It's not healthy. It's not healthy for the patients. Rushed in and out and just thrown a prescription, or at least that's my personal and professional opinion. But the way that we're doing things in the system is just very unhealthy. It's unhealthy for the patients. It's unhealthy for the practitioners. Practitioners are burned out, exhausted, anxious, overwhelmed to the nth degree. It's an epidemic, actually. So I realized I don't want to do it this way. I am going to start my own practice, and I'm going to do this better. So I researched what do I need to do to start my own practice as a nurse practitioner in North Carolina, and started jumping through the hoops of the things to do, and everything just fell into place. And I started a practice at the end of 2015, so beginning of 2016, and began seeing patients in my own practice, and would spend more time with patients and really get to know them and asking about their social emotional things happening in their lives and their background and their childhood backgrounds. And I started realizing the link between the childhood trauma and the adulthood diagnoses. And at that time too, I came across Dr. Nadine Burke Harris's work, her TED Talk about the ACEs study, adverse childhood experiences, and was intrigued, and it hit something inside me that already knew that this was true, that our childhood trauma and the things that happened to us in childhood greatly affected our present day adult self. I mean, not only socially, emotionally, and mentally, which we kind of know, but also physically, and that it also contributes to chronic diseases. And so this hit an aha in me, like, yes, follow that. And I would begin to follow that trail and kind of fell down that rabbit hole of adverse childhood experiences and childhood trauma being highly connected to adulthood, chronic diseases and issues, even including things like cancer, diabetes, heart disease, everything, basically. So around the end of 2016, I had been working with patients that whole year and still prescribing meds and finding these deeper threads to childhood trauma. And then they would actually like start talking to me about their trauma. And they were like, you're the first provider who's actually even asked me about what's happening in my life or what has happened or concerned about any of that or making any connections there. And I began this search for how can I help them on a deeper level? How can I help my patients on a deeper level with all the things that are happening and that have happened in their lives? There has to be a way for me to do that. So I was talking to a friend from Mississippi, and I was living in Charlotte at the time, and she said, you need to do this hypnotherapy training. And she had done it, and she was like, it's life-changing. It changed everything for me and with my clients. And she was a therapist, and I was like, hypnotherapy, what even is that? And she kind of explained it in the best way that she could. And it's just one of those things where it's hard to understand and grasp until you've like experienced it. But in my mind, I was like, oh, I don't know. That doesn't really sound, I don't know. It doesn't sound like what I'm supposed to do. Maybe I'm supposed to go back to school and become a therapist or something. She was like, I'm telling you, you should do this. This is a route to take and it's going to help. And I ended up joining like a virtual info session with one of the, who became one of my teachers, Melissa. Shout out to Melissa Ratliff in Tupelo, Mississippi. I did an virtual session with her, and she was explaining the training that was coming up that she was going to be having. And I heard some of the therapists talking about their experiences, and it was all so life-changing for them, not only for how they work with clients, but for themselves. And I was like, oh, okay, what is this? So it turned out I didn't make it to that training with Melissa at the time. Something happened and I had to go to the next one, which was happening a couple months later. I ended up at the one in October in Fort Lauderdale, Florida, with two other trainers, Karen and Terry. And this training was heart-centered hypnotherapy was what it was called. And it was through the Wellness Institute. out of Washington, Seattle area, Issaquah, technically. And I ended up in this 6-day intensive hypnotherapy training. Didn't know what I was getting myself into. It's just I felt a pull. I felt a call, like I'm supposed to go there. I don't even know what I'm going to do with this or how I'm going to use this, but something in me knew I'm supposed to go to this training. So flew down there, was there for 6 days, and this was my second awakening. That training cracked me open. And I thought I was going there for my patients. And I was, but actually I was going there for myself. So when I got there, all of this stuff started coming up. And it's designed this way. It's such deep work. It's subconscious work. It's inner child work. It's designed to bring up the things to begin to process and heal them. So all of my stuff started coming up and I started having what I later started to understand was shock symptoms, going into shock. Fight, flight, freeze. And the trainers are like, oh, yeah, you're just experiencing some shock. Here, take this ice pack or drink some water or go for a walk, And I was like, what's happening? In that training, we had to facilitate 2 sessions with our peers and receive 2 sessions from our peers. Very experiential, very hands-on. And in these sessions, we did age regression and went back into our childhood. So we would start with whatever the issue was that we wanted to work on, and we would do an age regression to find out where did this come from? What's the root? And it's really hard for me to even put into words what transpired in those 2 sessions that I received. And in witnessing and holding space for the 2 people that I facilitated for in that vortex portal that I was in. And one of the big things, so I'll say, I've evolved my work into include lots of different things, and I kind of expanded it for myself and for my work. But a foundation of that work is heart-centered hypnotherapy. And I want to give credit where credit is due to the founders of heart-centered hypnotherapy, which is Diane Zimmerhoff and her husband, David Hartman. A big piece of that work was, again, age regression and inner child regressing back, using hypnosis to regress back to childhood, and emotional processing the actual emotions. And that piece was huge. And in my sessions, there was an eruption of repressed emotions that I had never gotten to in all my years of mindset work and emotional work. I had done some emotional work. I had scratched the surface of emotional work and began that uncovering process and that excavation process. However, that only prepared me for this. This was like a jackhammer opened up the layers of concrete and split it open, and all this stuff just erupted up and out of me. One of my sessions, I regressed back to being an 8-year-old and experiencing sexual abuse. And this little 8-year-old self inside me, there was something, it's hard to put into words. So in this process, you release all that energy, through different ways. Anyway, the screams and the sounds that came out of me were, my 8-year-old was finally being heard. My 8-year-old self had been holding all this in for decades, and all of that was in there in my subconscious and in my body and in my nervous system. And this was an unleashing of emotions, rage, anger, guilt, shame, sadness, grief for the loss of myself, loss of my boundaries, my voice, my body, and something lifted. It was a release unlike anything I've ever experienced in my life. So this was the somatic piece in the body. So soma is the Greek word for body. We hear that word a lot. And I don't know if people truly understand, like, what does that mean? Somatic is of the body. So this was getting in the body and feeling out the emotions, not just intellectualizing and thinking through them like we do in like talk therapy or cognitive behavioral therapy, where we process intellectually and of the mind, which is a piece of the healing, but it's only a piece of it. So we have to actually get into the body and feel it. So this was the feeling of all those repressed emotions that were still stuck in my body and subconscious. So there was an eruption of this. There was tears and crying, and there was unleashing of stuck, repressed energy. And I felt like 200 pounds of pressure had been lifted from my chest. I felt like I could breathe deeply for the first time. And I hear patients and clients say this after their sessions. I've heard them say, oh, I feel like I could actually breathe for the first time. This is how crushing that energy is within our physical body is it creates pressure in our bodies, crushing, tightening, constricted pressure in our bodies. And it's all energy. It's all stuck energy and stuck emotions in our body. I just can't even explain that enough or say that enough until until people actually get it. Anyway, something shifted majorly in me in that training, and I came home and I started doing this work, started doing hypnotherapy sessions with my patients, and feel like I didn't even know what I was doing. I felt like I don't know what I'm doing. This is weird. They're not getting anything out of this. But people would come back and they would say, after just one session, they would come back and say, something changed, something shifted. I'm setting boundaries more easily. I'm using my voice more easily. I'm able to say no more easily. I feel lighter and less anxious. And I wake up in the morning actually excited to be alive instead of dreading the day. And I mean, I started having people come out of agoraphobia. People who had been agoraphobic and wouldn't leave the house were calling me saying, I went out to lunch by myself and it was I didn't even feel anxiety, and coming out of panic disorders and suicidality and depression. People started tapering off, like coming down on their psych medications. I mean, I was like, what is this? And what is happening? And I need more of this. I need to go deeper into this. So I just dove down this rabbit hole of what is all of this? What's happening? And my scientific part of my mind and brain and self wanted to know, like, how is this working? What's happening in the brain? What's happening neurologically? What's happening neurobiologically? What's happening physiological level, emotional level. I enrolled in a 2-year training with the Wellness Institute, and that training was I don't even, I guess hard to explain and find words for it. It was an initiation. It was an initiation into deep, deep work that it's just hard to even find words for. And if I had to find words for it, I would say it was an initiation into a calling and into energy healing and into spiritual work that's beyond what even I can even at this point still understand. So it was all encompassing. It was physical, emotional, mental, spiritual work. And in this 2-year internship, I just cracked more and more and went deeper and deeper into myself. And we would go on these retreats every quarter. So for 2 years, every quarter we'd go out to a retreat. And this specific group, there were like 19 people in my group. And we would come every 3 months and do a 5-day retreat and just dive deeper into trauma healing, inner child healing, addiction healing, codependency healing, using hypnotherapy and breath work, and all these other modalities and processes. And it was an experience of a lifetime, healing of a lifetime, cracking open of a lifetime, connection to self and spirit on levels that I had never experienced in my life, healing in connection with others that I had never experienced in my life, being truly vulnerable and truly being seen in the deeper levels of myself that I had never allowed before, connecting with others. And that it was just a deeply healing and expansive, sacred, and holy experience. So that training, wow, it was very difficult and very healing on so many levels. So I learned a lot more about trance work and subconscious work and all these things. So from there, during this time, I'm falling down this rabbit hole of holistic medicine, alternative medicine, mind-body medicine, trance work, subconscious work, meditation. What is all this? So like just really opened up. I started doing meditation trainings, and I ended up enrolling in yoga teacher training. So I did a 200-hour yoga teacher training. I did Reiki training. I did subtle energy healing, working with the subtle energy bodies. And then I ended up enrolling in a mind-body medicine PhD program with Saybrook University. Shout out to Saybrook. One of my professors there would say, you don't find Saybrook, Saybrook finds you. Saybrook plucks you out and says, you're coming here. And I feel like that's what happened. My kids were both in school. The year my son went to kindergarten, my daughter was in first grade and my son went to kindergarten. That's the year that I enrolled in my PhD program, because I was like, okay, both my kids are in school now and mama's going back to school to get a PhD. So I enrolled in this mind-body medicine program, and it was amazing, beautiful, and a journey of learning these deeper processes. I love the intersection of science and spirituality. And I feel like this program was such a beautiful merge of those two. And it's the actual like academic research of all of these mind body medicine practices and modalities. And that was such an expansive, amazing experience. I learned so much through that. However, COVID happened, of course, in 2020. And this was kind of a beginning of the end of my marriage and that relationship. And um, it was a very crazy time from 2020 to probably 2023, where I was enrolled in a PhD, working on a PhD. I was double enrolled in another program to get my psychiatric mental health certification. So I'm double board certified as a family nurse practitioner and a psychiatric mental health nurse practitioner. That psychiatric certification, I decided to do that while I was doing the PhD because I was like, I want to go ahead and get this certification so I have that. And again, this is how I do things. I'm going to do it all together, which created a tremendous amount of stress within me. So I was doing the PhD program, the psychiatric certification, and COVID hit. So then my business, my husband's business came to a halt for a bit. He was home. I was home. I had two young kids, first and second grade, and I had to like start homeschooling them. Everybody's home all day, every day. Like suddenly things are colliding, right? And it's a lot, and the world is shut down, and so there was that. And in 2021, we separated, my husband and I. And so there was like the PhD program and the certification program, and then a separation, and then raising two kids. And then it was like suddenly now I'm on my own and I have to figure out finances and run my business and make money. Yeah. And was still a very expansive period of learning and growth for me. And I will not speak for my ex-husband at all. Um, it was a very trying time. And the things leading up to that, things were got very difficult. And yeah, so this is going to lead into my third awakening. Yeah, it just keeps getting better. So thank you for listening. And I hope this was on some level inspirational for you, or that you received some nuggets of mm, whatever it is that you needed to hear or feel or understand. I hope this was able to offer something for you. Thank you.